Eating disorders can affect anyone in the world. Any type of person can be affected by an eating disorder. It's not limited to one type of person. In the United States, 20 million women and 10 million men may suffer from a clinically significant eating disorder at some time in their life. By age 6, girls especially start to express concerns about their own weight or body shape, and 40 to 60% of elementary school girls ages 6 to 12 are concerned about their weight or about becoming too fat, and this concern endures throughout their entire lives. Symptoms of eating disorders are preoccupation with food and body image or weight, a refusal to eat, abnormal weight loss or gain, and may lead to mood swings, physical problems, and death. Eating disorders are usually a survival mechanism. Sometimes they're used to help with low self-esteem, depression, feelings of loss of control, feelings of worthlessness, identity concerns, family communication problems, or an inability to cope with emotions. Eating disorders become an expression of something that an individual has no other way of expressing, and it comes out by trying to find control in one aspect of their lives. Eating disorders are usually caused by a mixture of genetic predisposition, cultural influences, and psychological problems. As you can see from this chart, which is going to be attached to the broadcast, they're interconnected and they feed into each other. The three types of eating disorders I'll be discussing are anorexia, bulimia, and binge eating. Anorexia is limiting food intake to extreme levels because the body is starving, the body slows all its processes to conserve energy, which can lead to an abnormally slow heart rate and low blood pressure. And it also leads to reduction of bone density, which is also called osteoporosis, and muscle loss and weakness, severe dehydration, fainting, fatigue, and overall weakness. Dry hair and skin and hair loss is common. Growth of fine layer of hair over the entire body, including your face, which is called lanugo, and it's the body's effort to keep your body warm, to protect it, because it doesn't have the energy to provide the warmth that it needs to survive. Bulimia is binging and purging. It is eating large amounts of food as fast as you can, and then purging it through either throwing up or extreme exercise or some kind of laxatives or some kind of attempt to remove the excess calories from your body. And some of the health consequences are electrolyte imbalances, which can lead to irregular heartbeats and possibly heart failure and death. Potential for gastric and esophagus rupture from the stomach acids, reducing the linings, and then tooth decay and staining from the stomach acids, chronic irregular bowel movements, and peptic ulcers and pancreatitis. Binge eating, it has many different names: compulsive eating, overeating, binge eating, but the consequences are the same. It can lead to high blood pressure, high cholesterol, heart disease, and type 2 diabetes or gallbladder disease. And all eating disorders can lead to death and increase the likelihood for mental disorders, including alcoholism, depression, and other mood disorders, and obsessive compulsive disorder. Treatments range from inpatient care or hospitalization to psychological counseling and treatment. Psychological treatment needs to work on both the eating disorder symptoms and the underlying causes. It's important to seek treatment as soon as possible because eating disorders are an escalating problem. So the longer they go untreated, the more severe the symptoms and consequences will become. As you can see from this chart, one thing leads to another, and it spirals until eventually you're back to where you start, but you're lower than you were when you started, and it just keeps spiraling down further and further. And this will also be attached to my presentation, so you can look at it more closely. Just remember, eating disorders can affect anyone, and if left untreated, they can cause severe physical and psychological problems, and it can lead to death. And the key is to get help as soon as possible, not just for the eating disorder, but for the underlying psychological problems, because if you don't treat the underlying problems, the eating disorder will either reoccur or it'll come out in a different form. So treatment is available for anyone and everyone. There's Like I mentioned, there's inpatient care or hospitalization or outpatient care, but find some kind of treatment if you have an eating disorder, and just get help as soon as possible because it can lead to death and it is a serious problem. So thank you for listening.